Not everything is a full mouth reconstruction or all on four. Sometimes traditional dentistry works great. We went from this smile to this smile with excellent use and excellent function. Let's talk about traditional dentistry. In actuality, this is what is done in most of the world. This patient here is no longer with us. It's been a long time, but this is something that I did probably 15 or 20 years ago for him. Let's take a look. It's a great option for a lot of elderly people. What you're seeing here is an old partial denture. These teeth right here are plastic teeth on a plastic base, and they're connected to the teeth that are left with hooks. And when you pull the lips apart, you see that the porcelain right here in the back broke off, so the hook doesn't really clamp on anything, and the plastic has seen better days. And this is what it looks like from the inside. As you can see here, the porcelain completely broke off these metal crowns. The hooks are not grabbing to anything, and this plastic was already broken several times and we had to repair it. And this is what you see when you remove the partial denture. Like I said, the porcelain is broken off the crowns. These two roots were left there just for support. This way the partial denture doesn't just sit on the gum, but sits on a solid tooth structure. But over time, this has started to decay. So we went ahead and removed those two old roots and removed the old bridge. And lo and behold, we have pretty decent teeth that we could make a bridge on. We fabricate a new bridge for the teeth right here, and in traditional dentistry style, we created locks right here that the new partial denture can snap right in. In addition, you see the little hook here? Well, this guy was much older, he was in his 80s and had some arthritis. So to help him take the partial out, we placed this hook that he could reach with his finger and snap right out. Pretty cool. You can see here, this is what a removable partial denture looks like. There's acrylic holding acrylic plastic teeth and special clasps that hook into the teeth that are remaining. So time went by, and like everything else, things wear out. And our patient noticed that the front teeth right here were shaking. So what do? Remake everything? Implants can come to our rescue. I went ahead and marked the site where I want the implant to be, surgically placed the implant into the bone, and in 2 months, we were able to connect an abutment. This one is called a locator abutment, and connect that with this special attachment into the denture. So now our patient has clasps that grab the teeth, and right here has an implant to stabilize the whole prosthetic. And also notice right here, there's a notch for his other finger, so he can take it in and out just like this, even with his arthritic hands. It's all about comfort and function. Not everything is a full mouth reconstruction or all on four. Sometimes traditional dentistry works great. We went from this smile to this smile with excellent use and excellent function. So now you know what a fixed removable combination means in restorative dentistry. From Prosthodontics and Implant Surgery of Manhattan, where people come in with missing teeth and leave with winning smiles, I am Dr. Zev Kaufman. Follow us on social media and give us a like. Maybe one day your smile is going to end up in our case of the week. Who knows?